The question is, who represents the public?
The law bars parents from citing religious or personal belief exemptions to get their children out of getting their vaccines. Now doctors say that law is not tough enough.
There's a very small number of physicians who have basically betrayed their professional oath.
Senator and Dr. Richard Pence says those doctors are manipulating the vaccination law he wrote, writing unnecessary or improper medical exemptions to allow children to avoid getting their shot. But the California Medical Board says it has opened investigations into close to 50 doctors who may have written invalid medical exemptions. He's now working with the medical board to help crack down on the rest of them.
When you have a physician acting unprofessionally and allowing other families to evade the law, someone needs to be able to represent the public and say that public health requires that we not allow inappropriate medical exemptions.
Now, the medical board says it can revoke a doctor's license for improperly issuing a medical exemption. It hasn't had to do that yet, but Dr. Pence says he plans to continue reviewing the data as well as his tough vaccination law to consider whether it needs to be rewritten.
I'm sorry.
Yes, please.
I just want to put
I
agree with everything Dr. Pan said, but I would like to just put a slightly different perspective on that. That as a physician taking care of a patient, my primary responsibility is to that patient. I want that patient to get the best medical care. I want that patient to be the healthiest.
The American Medical Association was founded in 1846 for a number of reasons, including to create a code of medical ethics. A physician shall, while caring for a patient, regard responsibility to the patient as paramount.
If a physician feels that there's a genetic association and a sibling, a cousin, some other relative, it's not safe for vaccine, they can provide a medical exemption for that vaccine. There's no limitation